Hi everybody, Dr. Cary here. Today I'm going to be going over rotator cuff stretches and exercises to get more flexibility and strength in the shoulder so that when we do our adjustments in the clinic and the patient does these stretches and exercises, it corrects the problem, reduces and eliminates their pain, gets the flexibility back, and prevents re-injury or reoccurrences. So let's take a look at this article right here. It's by Healthline, and I'll put a link in the show notes below because I really like Healthline. And it talks about 5 exercises for rotator cuff pain. It talks about what a rotator cuff injury is. And so we've reviewed that in the clinic. Impingements, tight muscles, poor motion, tissues getting pinched in between the ball and the socket. These are all possible with rotator cuff. So what do you do after you have an injury? Well, if it's a recent injury, then rest, ice, compression, and elevation, we use the acronym RICE for that, is good. Some patients will come and see me right after an injury, which is the best time. Some patients have had it for quite some time, or it's developed gradually over time, and that's more subacute or even chronic. A little harder to treat if it's been there. The longer it's been there, the longer it takes to treat it to get it better. The first stretch that's recommended is the doorway stretch. So in between, in a door frame, you can put your arms out to the side and just gradually, gently stretch out the shoulder muscles here in the front part of the shoulder. I would do this very slowly, not too quick, and with no jerky movements. So this is just an illustration, but I would go very slowly to stretch that and do that, hold it for 2 to 3 seconds here, and then slowly go back to the original position. I would do this 8 to 10 times and do 1 set of this to start. And just see how you feel, and then you can let me know in the clinic or report to your health professional and let them know if you're not a patient of mine. Side lying external rotation. This one's really good, where you take a light weight. I would start with a very light weight, maybe 2 or 3 pounds, and then have your arm on your side, and then just rotate at the elbow, but keep the upper part of the arm, the humerus, just on the body on the side like that, but just rotating at the elbow and twisting the shoulder right here. This is going to build up quite a bit of strength and stability in the back part of the shoulder where the 4 rotator cuff muscles are. And I would do 8 to 10 repetitions of this. Start with 1 set, and again, report to me or your health professional just to let us know how that's going. High to low rows. You'll probably need to be at a gym or have some elastics at home, but from a higher position, you kneel down and you're going to pull down, extending the elbows slightly behind the body and then reaching out. You don't have to go fully out, reaching out, and you don't have to fully extend, but you want to get through most of this range of motion. You want to do it nice and slowly, and you want to keep the elbows in towards the sides, not flailing out to the side. And that's going to really build up the latissimus dorsi, that large muscle group that extends the arm backwards in the back. It's a really large group of muscles. The reverse fly is good. Now, the first thing is make sure you're in a good position posture-wise. Pivot at the waist, keep a neutral spine or a flat back. You're at an angle around 45 degrees or maybe slightly more towards the ground. And you want to take some light dumbbells, 2 or 3 pounds again, and then just raise your arms out towards the sides. You don't have to fully extend them out, but I would say 75 to 80%. You can have a slight bend in the elbow, like this lady has, and then raise your arms up, hold, and then back down. So I would bring your arms out parallel to your body here. And what it's going to do is it's going to work the rear deltoid and some rotator cuff muscles in the back here. So I really like that. 8 to 10 repetitions, and I would do 1 set. And then the lawnmower pull, I really like this one too. Get an elastic band, start really light, and I think they're all color coded now, so you can get the lightest color, very flexible, and then the stiffer ones are a different color. I know when I go to the gym, The blue is second most resistant. The black is the most resistant. So put this underneath your foot. You want to reach down slightly towards your foot, and then as you raise your body up, you're going to twist your arm and you're going to extend your elbow. So you're going to kind of pull and twist like you're pulling on a lawnmower to start it. So this is an excellent combined movement. If the first 4 are going well that we went over, then you can get into the 5th one. So after you do the first 4 on a daily basis and that's going well, then you can get into 8 to 10 repetitions of this. And I would do both sides. I would do the left and right arm, even if you just have a pain in one shoulder. It's good to do both because you want to balance the two and keep symmetry. So this is good. If you have any questions, feel free to ask me in the clinic. If you do want to book an appointment at the clinic in Kelowna, I am accepting new patients. I'll put a link in the show notes below. Also, if you're, outside of the Kelowna area and you want to talk to me, I'd be happy to do an initial consult with you. I usually spend about 20 minutes discussing that with the patient or the person, and then referring that person to a chiropractor in their area. So if you're not in the Kelowna area, I'd be happy to talk to you and refer you to somebody in your area that can help. And you just have to click on the link in the show notes below. So there'll be 3 links, one for this article, one to book an appointment in the clinic, and the third one for a consultation if you don't live in the Kelowna area. I want to thank you for joining me today, and I will talk to you guys soon.